Hello and welcome. This morning, I want to introduce my guest, Susan Stukes. Susan is coming to us from the dental health space, and I met Susan, and we've had great conversations, and I'm really looking forward to our time this morning, and as we explore. So, Susan, welcome.
Thank you. Thank you for having me.
Tell us a little bit about yourself and how you got into this space.
Well, I'm a third generation dentist, graduate of Howard University, and Howard University is getting a lot of attention now because of our potential vice president. I'm graduating from Howard, but my professional career took I just went with the journey. My plan was to be a private practice physician. But when I got out of school, I went into the military. So I went in as a captain and started learning about setting up mobile dental situations, working in non-traditional settings. And so when I came home, I found myself with these skills and finding that private practice was not that rewarding to me. And it just turned out that there were people in my community that were not dentists, they were ophthalmologists and like that, who were taking teams over to other countries. And I said, I'll come along. And this is when I began to use my skills to improve access to healthcare for people that normally would not have access. So from there, I fell in love with public health and community service. And so over the years, that's been my career. You mentioned the correctional field. I did work over 20 years in corrections when I left my career, in corrections for New York State, I was dental director for Sing Sing Correctional Facility, which is a maximum prisons. I ran their program. But I also, on the other side, was able to be creative and set up programs. I did my own mobile dental program, which reached domestic violence survivors, migrant workers. I would set up in substance abuse facilities and provide them with dental care. And then my team would also go overseas, and I would have not just dentists, but anyone I could drag into coming with me, really. I would put you to work. I had parole officers. I said, I will find something for you to do. But we would set up in schools, all types of settings, churches. And so I worked in many countries doing that, and also had the opportunity to work with the World Health Organization on safe motherhood. So I've had it's all been improving access to care and serving in the public health capacity. But I've had an opportunity to work in different areas of healthcare, supporting safe motherhood and like that. And I just never regretted it. I just love it. Now I run a dental program for a community health center. And so here again, I'm able to work with people that are very appreciative. And I get to also give them information and empower them to take better care of themselves. And so that's what I've been doing, and it just has evolved as far as my whole health work. And now I'm seeing that I really want to make sure that not just individuals get the access to education to manage your health, but that this access is also something that I want to see integrated in not just the community health settings, but in private practice on the primary care side. So I've recently been doing work to share oral health techniques to community health workers and nurses and people like that, because I want everyone to join the dental profession and helping us to provide care in a whole health way. So that's kind of what I've been doing.
Wow, that is busy. That is very busy and very diverse.
Yeah.
Talk about the penitentiaries, feeding the
Yeah.
institution. I mean, that in itself is another subculture. But then you talk about going to various countries. What are some countries that you've been to? You've done programs for?
Well, I started in Haiti, actually. Started in Haiti. I have roots in Jamaica, so I've done work in Jamaica. Then my group, we started working a lot on the continent of Africa. So Ghana, I've worked in Senegal, Mali, Cote d'Ivoire, done some work in Uganda.
Oh, right.
We presented in South Africa, so I didn't do work there. But then also in Central America, we've done quite a little bit in Belize.
Mhm.
We've gone to Gambia, Cameroon.
Mm.
So yeah, because then a lot of my friends um, got the international bug, and so as they would go and move to other countries, they would invite us, and we would go visit them, and we'd
Of
bring the
course.
team.
Of course.
And so, yeah, it just became work and fun.
It sounds like a great way to incorporate your vacation with contributing and giving back.
Yep.
Because, for instance, if you go somewhere on a vacation for 2 weeks and you can help to bring healthcare awareness and life-saving information to others, why not make it part of that?
Yeah, and once I started traveling like that,
Mhm.
just the normal way that people travel became. I would only do that when I would be totally exhausted and I just wanted to lay on the beach.
Yes.
But other than that, I mean, I just love traveling and working because you really get to know the people of that country,
Sure, exactly. And integrate
and
it.
it's beautiful. And when we would travel, we would spend part of the trip, the work trip, we would live where we worked.
Yes.
And then we would always have a vacation part because people were using their vacation time and
Mhm.
people wanted to have fun and everything. But we just loved living, right there in the community.
Mhm.
That it's just no better way to
Oh, yeah.
learn about other cultures.
And
It's
contribute,
beautiful.
right? When you go as a tourist, you add to the waste and you consume. But when you go with that kind of work vacation concept, you give back. So you're
Hmm.
not just touristing, spending and adding to the litter.
Yeah, yeah, right.
You're actually leaving something back. When
Hmm.
you leave something, you give it back to the community. So that sounds like such a beautiful way to vacation.
It's beautiful and very, very rewarding.
Absolutely.
I gained so much from
Mm.
the work and that type of travel. It's just,
Hmm.
I can't even, put into words how much I benefited and learned. And my whole team, we learned so much.
Mm.
So it's beautiful.
That
Yeah.
is amazing. So are you no longer doing those trips?
I haven't traveled in a while. Started just doing a lot of things here in the States.
Okay.
And it's crazy because, and then, a lot of us got involved in other things,
Of course.
professionally.
Yes.
And we really had just started my group, International Health Professions Network. We had really just started getting back together and said, okay, we want to start traveling. And then COVID.
Mm. Well,
We were
it's a
planning,
whole
yeah.
different
Oh
conversation
my God. We were
now.
planning, exactly. We were planning to go to Ghana, which was, I kind of considered almost like a second home. I used to go so much. And we were, reaching out and we were getting these preliminary plans together. And
Mhm.
one of my friends sent me a letter from the ministry in
Mhm.
Ghana, which pretty much said, don't bother come. You know what I
Mhm.
mean?
Oh yeah, absolutely.
We do not want any Americans right now,
No,
okay?
no, no, no,
So,
no.
so that was that. Okay.
I mean,
So,
I mean,
yeah.
here we are in the midst of COVID-19, but reality, we're in Canada, we're your closest neighbor, and our border is closed.
Wow.
COVID-19 has changed so many things,
Oh
and
my
so
God.
many, people's reality and mindset has changed around, how we're going to integrate and how we're going to connect. And just because there's so much unknown to this disease, it really has changed things. Yeah.
Yeah, it's true.
Mhm.
We're being creative. I mean, these virtual meetings are a lot of people like, you
Yes.
know,
Yes.
and so that's been something very nice that I've enjoyed. But it's definitely a huge switch that was just thrust upon everyone.
Oh,
You
yes.
really
I don't
have a
think anybody could
chance.
see or plan. I don't think anybody could have conceptualized this. I know there was talk about preparing for eventual global pandemic, but I don't know if anybody could have visualized the
Mm,
reality of this.
no. Mm-mm. Especially in the States, because we're we're so used to everything being managed. I mean, we've had threats of these different types of things, and never, would always be a little outbreak, nothing really
Yeah.
big, or would be some other country,
Hmm.
some other country, and we could watch like a movie and say, oh,
Hmm.
so we really here they're just in shock, that
Absolutely.
this is actually reality,
Hmm. And
here.
it's a brutal reality for many, many people. So many people have lost loved ones,
Oh, I know.
and it's continuing on a daily basis. So,
Hmm.
so that brings in itself, with it a certain level of fear and uncertainty in our society today. So one of the things that I do in my business and in my work is focus on wellness,
Hmm.
and more exclusively wellness at work.
Hmm.
So we spend time with, trying to help organizations to identify the interpersonal well-being relationships,
Okay.
interactions. That's our dominant area of focus because I'm a conflict analyst. So I see the world through the lenses of a
Oh,
conflict analyst.
okay.
And so the whole world of relational well-being and how our interactions can impact each other, or cause burnout and wear and tear on our mental and emotional state. So we do a lot around emotional wellness. And one of the things that I teach, and it got me to create, I was driven to create this 9-dimensional wellness model to help my clients to understand how each area of our life impact. And it starts with interpersonal at the core,
Mm-hmm.
interpersonal wellness, and it branches out to show that as our interpersonal dynamics and our interpersonal realm is interconnected with all the other areas of our life, the spiritual, the social, the emotional, the intellectual, the occupational, environmental, financial, and physical. So I go around and I teach people how to do that, and then I created a wellness competency mindset teaching program
Oh,
and coaching program
wow.
around it. So I train and certify coaches and facilitators in using this concept with others because it's such a different way of looking at well-being that it connects very deeply with people and
Mm,
boosts transformation. So
mm,
as we do that in organizations, it's another way to reach employees who probably are used to just doing things like maybe some workout, yoga, jogging, aerobics, or what have you, when they think of wellness, but really getting wellness from a different lens.
mm-hmm.
Um, it's very compelling how motivating it is for them to do something about it. So
Mm-hmm.
as we talk about oral health, which is where
Mm,
you fit, that would
mm-hmm.
fall under our physical wellness dimension. And as we encourage people to improve their physical well-being, um, I love what you do in oral health because I wanted to help to bring that and weave it in so people
Mm,
can actually get a sense as to how important that is. My mom is right now. My mom has like liver cancer. My dad died of throat cancer. He
mm,
was a smoker. And the other day I was brushing my tongue and I was like, oh, I better look at my tongue to see if
mm.
there are any spots. And so let's talk a little bit about what should people know about oral health. What are some key things that we should start thinking about as we move
Mm-hmm.
through generally, and then we'll weave more into even the phases as we go through.
Well, first, you touched on a lot of things that that's how I approach oral health. So, first, I like people to take a step back and just remember the oral health is not just your teeth. It's the mouth is a very intricate system of and all kinds of things going on at the same time. So in addition to the teeth, and even the teeth we look at as just these hard pieces of chalk, but
Mm.
they're living. You've got nerves and blood supplies. You have over 700 different types of microorganisms that live in your mouth, good and bad. You have saliva, you have your muscles, you've got nerve endings, And all of that responds just like the rest of your body responds.
And the taste buds, very
And
important.
your taste buds, sensory, your sensory perceptions, and
Mm-hmm.
all of that, and all works together as you're sharing. And
Mm-hmm.
like, and as you also shared, you talked about 9 aspects. You
Mm-hmm.
talked about environmental and emotional. Those are all aspects of oral health. So I talk usually about 5, but they're all related. So if you talk about emotional health and the mouth, a lot can show up in the mouth. You
Mm.
talk, yeah, absolutely. You talk about the physical health, of course, that can show up in the mouth, or there's things that can show up in the mouth before it shows up in the rest of your body.
Oh, lovely. Tell me about
hmm
that.
So all these things, your hormones, if you're, and you talk about spirituality, even that. If you are stressed and you're not grounded in something, that's stress. That can show up in your mouth. The way that your body um, tries to handle it, a lot
Mm-hmm.
of times can show up in the mouth.
Oh gosh, I feel like I need to tell you. Okay, take a look at my mouth now. What can you see? Do
So
you get
that's
people
what.
telling you that? Do you
Yeah,
get
yeah,
like,
right. Yeah,
okay,
or
come
they
on,
go,
take a
or
look
they
at
go,
my mouth.
or they go, oh, okay. But
I
so
want to
that's
know. I'm not covering. I'm like, tell me, what do you see?
I see a beautiful, healthy smile. But that's what I want people first to understand,
Mm-hmm.
that when you're thinking about your oral health, it's all of that.
Mm-hmm.
And just like when women go through the change of life, things like dry mouth, the hormonal effects, all of that shows up in the mouth. So that's number one. I like people to, just kind of embrace.
Mm-hmm.
You know, you talked about workplace wellness, and before we got on, I was online and I found this interesting study. It was interesting because it talked about Canada and the United States, and it talked about hours lost due to dental issues. And let me just read it for you. In Canada, this was 2018.
Oh,
The study says that 40 million hours were lost due to dental issues in Canada.
oh.
In the United States, so they calculated that to be about 3.5 hours a person. Now that doesn't seem like a lot for individual, but if you think about the whole population and you think about the population of people that are working,
Mm-hmm.
that's a substantial number.
Yeah, some of my clients have 10,000 employees, 3,000
Exact. So
employees.
that's right. You
Add
know,
that up. That's
you add that up, and I'm in the
this is
United States.
annually, right?
This was for the year. This was,
Wow.
yes. And I could send it over. It's a very nice article. I'll send it over to you. CDC put it out.
Okay.
But in the U.S., it's much worse. It's 320 million hours are lost, with 92% of those being unplanned. That means emergencies.
Mm-hmm.
So just to get, and this article went on to say that it's important for employers to integrate oral health into their workplace wellness programs. So
Mm,
you are ahead of the game.
apparently.
Yes, yes, you are. So this is what it was saying, that just showing how important it is,
Yeah.
for us to focus on our oral health. And when it comes to the workplace, it can have a substantial negative effect. And
Mm-hmm.
that doesn't take into account that the mouth is connected up to a lot of other diseases like heart disease, diabetes. So a person might lose days of work, let's say because of their diabetes, but it might really be related to the inflammation in their mouth that's causing their diabetes to flare. So they really don't, that they said they couldn't really calculate all the other kind of
Mm-hmm.
influences, but just to show you that it's a huge issue, and that you are, highlighting oral health is wonderful. So I definitely applaud you for that, because it's really a much needed discussion that needs to be had.
No, you talked about, hormonal changes.
Mhm.
Do men have changes? They don't have hormone changes, but something happened to men. I know it's not menopause, but what? Something happens to them.
Well, they do have some hormonal changes, which can show up in the mouth as well. You know,
Okay.
things that also show up as we get older, and we're talking like especially about emotional health.
Hmm.
A lot of people that are stressed at work have difficulty sleeping.
Yes.
Okay, or might have little bouts of depression, and they're on medication. That affects the mouth because a lot of them end up with dry mouth, which makes them more susceptible
Hmm.
to things. So all these things connect up. And if you're not aware, you could find yourself one day with really bad problems, which you might have been
Such
able to
as what?
reduce.
Give
Well,
me
let's
some.
say, yeah, so say like dry mouth, the saliva is what buffers, and that's protective. So if you have dry mouth, you don't have any saliva to protect your teeth or your tissues.
Yes.
So you could develop a cavity and let that cavity become huge in a short period of time. Also, the mouth becomes dry, not to mention, difficulty swallowing and things like that. But as far as the dental structures go, you're more susceptible to having ulcers and
Mhm.
different things like that. But when the mouth gets dry, and see what happens is a lot of people think, let me suck on something. So a lot of times, if they don't know, they suck on a hard candy. That sugar, in addition to no saliva,
Okay.
means within a very short period of time, they can end up with really bad cavities and infections. So
Uh-huh.
those are the kinds of things that if you're not aware, and
Yes.
that's why integrating it into primary health care is important too, because
Mm.
the physician's office not letting you know this, if they have to prescribe you something,
Mm.
that has those some other kinds of effects that might alter your mouth,
Yeah.
they don't get into that. So the patient doesn't know, you
Mm.
know, and they
And
go
the
for a
patient
long.
should ask, right? I really like to advocate that patients
Yes,
have to remember that you are your best advocate. Ask your doctor what are the side effects. Absolutely.
absolutely. And ask whatever you have going on, ask, do you think this might have some effect on my oral health?
Mm-hmm.
You know,
Absolutely.
always remember there's most likely going to be some connection to your mouth.
Yes.
And that's something we just don't think about, you
It's
know.
true. Because the
Mhm.
mouth it's really the gateway to everything. Everything
Mhm.
goes through the mouth, right?
Yes,
To an
right.
extent, everything from on top goes through the
Mhm.
mouth, right?
Mhm.
Yeah, we taste everything, everything goes through and do we yeah,
We just don't think about it, we just don't, and I have so many patients, especially my diabetic patients, they come in and their teeth are very loose.
mm,
We have to take out a lot of teeth. I don't know how many times I've heard patients say, no one ever told me that. I wish someone would have told me that my diabetes was, going to put me at risk of losing my teeth or, having bad gum infections and things, and they just don't know. And in the primary health care field, they still are not, wanting to share the importance of this connection.
mhm.
Yeah.
So I
So,
didn't realize diabetes could affect your teeth and your gum.
oh
That's
yeah.
interesting.
Oh yes.
Oh,
Yeah. They call periodontal disease. They consider the sixth complication of diabetes.
oh,
Hmm.
interesting.
Yeah. So that's how much of a connection and a complication
Mm.
diabetes can cause. And
I
then
know somebody I should be telling that to.
yeah.
Somebody I know says,
And
"Oh, just a little sugar." I was like, "Oh, just a little sugar." There's no such thing as just a little sugar. My
no,
sugar is
yeah.
a little bit. You came and said, "Oh, my doctor said my sugar is a little bit high." I was like, "There is no such thing. That's pre-diabetes. You need to do
Yeah,
something
right.
about that."
Yeah, right.
And he was like, "No, no, no. It's just a little bit high." I'm like, "There is
Oh my
no such
God.
thing."
Oh,
Just blown away.
I know. And it's just little changes people have to make. I think sometimes people think they have to make these huge changes and they just don't want to deal with that.
Mm.
But just minor changes, just the awareness part, can just prevent so many things. But And the flip side with diabetes is if you have gum disease, sometimes it's harder for you to manage your A1C.
Yes.
So they've shown that, by making sure that this person's oral health is good and they have, not much inflammation in their mouths, that
Mhm.
they can reduce their A1C just by oral health.
Wow.
hmm Yeah.
Okay.
So these connections are there. And you go to work some days, you don't realize why you're not feeling good. Some of these things are connected to your mouth.
Absolutely. Because as
Mhm.
you talk, I'm thinking diabetes is one of the fastest growing diseases in our society. So many
Oh
young
yeah.
people are showing up with diabetes. It's
Mm.
not an old people disease anymore.
Mm-mm.
It's something that, many people in their midlife are telling me they have diabetes, even in their 20s and 30s. And I'm like,
Mhm.
huh?
Yes.
And it's just like, it's the way when you say primary health, the way they get the information to them is just like not a big deal. It's just a little high.
Right. I know. And in a lot of offices I know in the States, they don't have a lot of time. They getting them in, boom,
Mhm,
boom, boom.
mhm,
Um, and then there are resources. There's health coaches, there's diabetes, there's all kinds of educators and,
mhm.
folks like me that can also link into the offices to
Exactly.
support the patients.
Yes.
It's just, them recognizing it's important, you know
Mhm,
definitely to give them this information because and with the diabetes, they have so many studies on diabetes and inflammation in the mouth and how it just accelerates other issues that these diabetic patients have, with their kidneys and their heart. It's just,
mhm.
you know, yeah, and it's preventable.
Mhm.
Yeah. hmm
Wow. I learned a lot. I learned a lot.
yeah. yeah.
And
It's
and I think our audience will too, because oral health is something that, well, here we're covered, and then
mhm.
my dentist will send a note, and every 6 months you go for your cleaning, and he does, and oh, you need
Right.
to fill in, or well, maybe let's take a look at this, or let's fix this bridge or something. But you don't put more than that to it. But having
Right.
it connected back to recognize, the things that are happening in your health can show up in your mouth is so important.
And just like with diabetes, self-care, self-management for the mouth, you're only going to see the dentist. I mean, if you're really a good patient, which a lot of my patients, that would be twice a year. Okay. And if they're good, once a year. But that leaves a whole lot of time in
Yes,
between
yes.
for a lot of things to go wrong.
Mm-hmm.
If you don't know what to do or you don't know what to look for,
Mm-hmm.
you just, to leave that so much of your smile health in the hands of
Mm-hmm.
others
Yes.
when it's really a lot is and you when you go to your dentist, it should be a nice visit where, you know, you get a cleaning and they just kind of confirm things that you
Yeah,
can't see.
exactly.
It shouldn't be that that's why a lot of my patients are stressed because they don't know what we're going to find in there. And they're afraid. And so when I say everything looks good, they're like, really? You know, and it shouldn't be like that. We
Uh-huh.
each of us, like I was sharing with you, you do a breast exam, you check your skin, you check your blood pressure. We need to keep up with our end of taking care of our smile.
Absolutely. I chuckle because I remember when I when I met my husband, I was in my 20s, and the first time he stayed over, the I was brushing my teeth, and then he saw, and he's like, "Oh, do you have dentures?" I'm like, "What do you mean?" He's like, "Well, you're taking time and brushing each teeth. You're
wow.
brushing each tooth separately, and then yours just brush them."
Yeah.
Never forget.
Yeah. Because why would you?
Like,
Yeah.
I brush them because they're
And
mine.
you want to keep them. And I have so many patients. They'll say, "Oh, just take them all out. Life will be easier." Well, I'm like, first of all, I said, if you go to an office and they agree to take all your teeth out, you should run because
Mhm.
you should not be there. And dentures, a lot of people think, oh, just take them out. You do not want to have dentures. They're that's all heavy acrylic in your mouth. Some people will say that they can't taste their foods like they used to. Sometimes they don't fit good, but a
Mhm.
lot of people feel it's much easier to just have dentures. But the oral health is really very simple. It's not, there's some basics to it, and certainly understanding how things connect up so
Mhm.
that when you see things, you'll say, oh, you know what, that's probably what it is.
Yes. Yeah, and we can
And let
take care
me,
of our health.
yes,
I
exactly.
love that. I think we do need to empower ourselves. The days where we rely on our physicians and our medical professionals to take care of us are gone. Like they should be our partners.
That's
And
correct.
they're the
Mhm.
experts. When we notice something, we can share, oh, I'm observing this. Here's what I did. What are your thoughts? What's the next step? So
That's right.
it makes their job easier,
It's
our
and
lives
then
better.
yeah, and then you get a better outcome because
Exactly.
you're not going you're going now to enhance your treatment options.
Mhm.
You've done your part and you've looked into some things.
Mhm.
So you two together can come up with this great plan
Exactly.
versus you just come in and you're leaving it up to others to start from scratch to kind of try to put together what's going on.
When they
But if
have like
you
10 minutes.
Oh, right, and they don't have a lot of time.
Yes,
So it's definitely should be a partnership.
it's
It
definitely,
definitely.
yes.
And in understanding like any other part of your body, it takes some time and love to take care of. You would,
Absolutely.
if something's wrong with your foot, you don't go to the foot doctor and say, just cut it off and life will be easier.
I
You
know.
don't do that. And the same with the mouth. Just takes the
So
same
true.
care and love
Yeah.
because your teeth, like you said, is the gateway to digestion, speaking. This is how we show, express who we are, and it says so much to others when they meet us. It's a very, very important, and it deserves some love and attention.
Good. I say good, good, good. Thank you so much for sharing your wisdom with us this afternoon and giving us some insight on oral health. I really appreciate it, Susan. Thank you so much for being here.
You're welcome.
So, if my audience want to connect with you, where do they find you?
So they can contact me. I have two sites. The one that's focused on oral health is Save a Smile. So that's SEVASMIL.com, LE.com. And I'll send you the information so you could certainly share it.
Mm-hmm.
My main site, which you can get to everything, is sevalife.net, which is SEVALIFE.net. So if you go on there, you'll be able to see the oral health section. On there, there's something that I would encourage your followers to check out. It's a little roadmap. It's a little postcard, and it walks the people through how to do a dental self-exam
Lovely.
and record that and start to use that as your baseline so you could start making sure you don't see changes or everything is fine. And so when you go to your dentist, you're going to be, ready to go. So there's some good resources like that if you go to the sevalife.net.
That's exciting.
Okay.
Thank you so much. I really appreciate it. Thank you for being here.
Thank you.